We'll also share Thank you so much. We'll also share the recording with all registered participants after this webinar. You'll also receive the slides by email. For your comfort and for the comfort also of the presenters, the audio is disabled for this webinar. So please feel free in the chat box to say hellos, but we'd like you to actually use the Q&A for any questions you'd like to raise, and then we'll try to address these all at the end. We do have with us today also Eva and Ali from the Women's Brain Project team. They will try to get to your questions as well during the course of the webinar itself, but certainly at the end of the webinar, there'll be a dedicated Q&A session where we'll try to address all your questions directly. And then also feel free to share highlights of this webinar on social media using our Women's Brain Project hashtag. That would be fantastic. Thank you so much. And also talking about thanks, we want to say a big thank you to FPA for supporting and disseminating that this webinar will be taking place through their network. We really appreciate the support from the FPA team. And also we'd like to mention a thank you to the sponsors for this project as well, Roche and Organon. So a thank you also to them. And then here in terms of agenda, so without further ado, we'll present the speakers of today's webinar. Then Emmy from Economist Impact will present the key findings of this research. Then we'll have Marie-Theresa from the Women's Brain Project team will be presenting our call to action. We'll have expert commentary from Anders and Cheryl. And then also we'll be talking about the launch. This report was actually launched, the white paper, on the 8th of March, the occasion of International Women's Day, and we'll be talking about next steps in terms of the project itself, but also from a communications point of view. And then last but not least, we'll have our set piece dedicated Q&A session. Then here we have our presenters for today. So we have ourselves from the Women's Brain Project team, and I'll be passing over to Marie-Theresa very shortly. Then we have Emmy and Michael from Economist Impact, who'll be covering basically the key findings of this project. And then we have our expert commentators joining us today, Anders Wimo and also Cheryl Carcel, who's joining us, would you believe, from Australia. So in the wee small hours of the morning. So we especially appreciate Cheryl joining us for this webinar today. And then without further ado, I pass over to Marie-Theresa.
Thank you, Anna, and a very warm welcome from me too. Antonella Santuccione-Chada, our CEO, was actually supposed to tell you something about the Women's Brain Project and open this webinar, but unfortunately there has been a personal issue that requires her immediate attention. So she's sending her greetings, but she can't be here right now. So it is actually my privilege to introduce to you the Women's Brain Project and this specific project of today with the Economist Impact unit. So for those of you who are not familiar with the Women's Brain Project, this is a non-profit association founded in Switzerland, but active globally. It is composed by experts like me in neuroscience. Antonella is an expert in medicine. We have psychologists, pharmacists. Anna Day is our expert in policy, communication, but we really have experts from a variety of different fields. We work together very closely with patients and their relatives that are also part of our team. And we have a number of ongoing projects where we collaborate with healthcare professionals, policymakers, private sector, and basically all the stakeholders that are involved in the brain and mental health space. Just a few numbers. This is a group, a relatively small core team. but a very wide network of collaborators and supporters, a very wide social media reach, and numerous, more than 40 international collaborations. We collaborate with the really top research institutions, both in academia and in the private sector. Our work has been recognized by numerous prestigious awards. And as you see here, we have over 100 publications, and this is really the main thing that we do. Our overarching goal, as you probably know, is to improve the current state of healthcare by integrating sex and gender considerations towards precision medicine. And for us to achieve this goal is key to generate evidence. So we have a lot of our work is actually evidence generation, publications of scientific research, and also publication of policy documents like the one we are discussing today. So we have been pioneering in the world a global discussion and research activities in sex and gender differences in brain and mental disorders. In terms of the project that we are discussing today, this is a very special one and one that we are extremely proud of. And I would like to spend a couple of minutes on this slide just to tell you how we came to this idea and why we felt that this was absolutely important and we had to be leading this. As the Women's Brain Project, we have spent the past, let's say, 7 years studying, publishing, reporting sex and gender differences in brain and mental disorders from the health, medical, and scientific point of view. So we have been publishing papers on differences in biomarkers, in diagnostic criteria, in outcomes, in clinical trial design, caregiving burden, and all that. At the same time, though, we have been leading quite a lot of activities in the policy space, making the point of the importance, the economic burden of brain and mental disorders, which are our focus. We have been collaborating with the WHO on the Global Action Plan on epilepsy and other neurological disorders, highlighting the importance at the societal level of these diseases, and on numerous other projects where we were talking about the burden of these diseases. So at this point, it was basically natural to ask how these two things go together. So we know that we have sex and gender differences in diseases, in the epidemiology, in the symptom presentation, in the treatment, in access to healthcare. We know all that. And we know that these disorders have a huge economic impact on the society. So our key burning question that we felt at some point we could not answer, we had to do it, was how would these sex and gender differences that we have been reporting and documenting actually impact the economic burden, and what is the economic case for investing in more sex and gender specific research. So for us, this has become a priority. We felt that this was a gap in our knowledge that we needed to fill, and as in other occasions, we decided to go ahead and actually do the work and again pioneer this activity. So we decided to partner with Economist Impact, first in class in this space, to actually develop together a health economic study, which is quite complex and built in different steps. I will tell you more about it, to make the economic case for investing more in sex and gender and bring sex and gender differences at the center of the scientific debate. In this slide, just to explain to you the process, because this has been quite a long project, as you can imagine. We have started with an evidence review. This is largely based on the literature, and we have decided to focus on 5 brain disorders: multiple sclerosis, stroke, Parkinson, Alzheimer's, and migraine. We've chosen them so that we would cover both diseases that affect extremely young individuals, but also the age population, both men and women, and with different type of disability involved. Very key in the process of creation of this white paper has been the engagement with experts. We have looked for really international experts from very important stakeholder groups, kind of outside of our team. And this has resulted in having experts from the WHO, from the London School of Economics, from the NIH, as well as from academic centers, both in Amsterdam and Sydney. And you will hear more about our experts. Thanks to the evidence review and the expert engagement and their input, we were able to build together with the Economist Impact team has built a conceptual modeling framework. And this is really the heart of this project, because for the first time, we have mapped the different variables that are most likely affected by sex and gender differences, and to identify how investing in them or acting on them could actually change the economic burden of neurological disorders. And the final step, of course, the reporting with the launch of the white paper that you heard on March 8th. This is officially the first virtual launching, so we are very thankful to FPA for the space and the possibility to discuss with you all our results. And stay tuned, because we will be reporting and presenting results at multiple international conferences, so there will be more and more occasions. And one final slide, again, to acknowledge and thank the international experts that have contributed to this white paper. We have Dr. Cheryl Carcel, who has kindly made herself available in spite of the crazy time of the day to be with us today. But also we had Dr. Janine Clayton from the Office of Research on Women's Health at the NIH. We had Dr. Tarun Dua from the Brain Health Unit Department, Mental Health of the WHO. We had Professor Martin Knapp, who's Professor of Health and Social Care Policy at the London School of Economics. And we had Professor Bizia van den Vlier, who's a very well-known expert in Alzheimer from the Alzheimer Center in Amsterdam. And they have been giving a tremendous contribution in terms of collecting and identifying and interpreting the literature, as well as building the conceptual framework. So a big thank you to these experts. And I think with this, I'm done with the introduction of the project, and I will pass the word to Amy, who will walk you through the main findings. So thank you, Amy.
No worries. Thank you so much, Maria Teresa. Lovely to meet everybody online, or at least speak to you about this important project. My name is Amy Michael. I am a Global Health Research Manager at Economist Impact, and led the team that supported the Women's Brain Project with this really important work. So Maria Teresa has gone through the approach and a bit of background on why this topic was so pivotal and important to address. I'm going to walk through some of the key findings that came out of this really kind of first initial step on a journey to really capture the economic impact of sex and gender and their role in driving outcomes and progression in brain diseases. So first of all, starting off with a bit of background, it was quite clear from us during the initial rapid review of literature, that there was a real sex and gender lens when it comes to brain diseases, which is quite clear. But what was really important was to define the context around some of those sex and gender lens issues, and what the existing knowledge of and intelligence around each of those factors were. We captured the fact that brain diseases are increasing in prevalence, and like other social determinants of health, sex and gender have a real influence on the prevalence, onset and progression of brain diseases, but also from a clinical research and practice perspective have an influence on prognosis, and also diagnosis and transition from diagnosis to treatment based on various social, biological and genetic factors. What was really clear, and why it was important to look at this from a sex and gender perspective, was because there were determinants that were based on sex and gender. Women live much longer than men, and we found in our literature that actually they live longer also in disability than men do. So really it was important for us to capture this and understand what the reasons and factors behind driving this. And then finally, from an economic perspective, the real case was around the fact that women often are forced to leave the workforce, not only due to impacts on their impact of these brain diseases on their health, but also the fact that from a society perspective, women are often caregivers and need to contribute to unpaid care. And that often means leaving the workforce at pivotal moments within their career.
Amy, sorry to interrupt you, but before you go ahead, we are noticing some issues with your audio quality. Is there any way you can adjust it maybe. I don't know if you're using your earpods and we can switch. Can you try?
Yes,
This is way better.
Yes, okay.
Yes,
I can.
yes. Thank you. Sorry
Great.
for the interruption.
No, thank you. Helpful. Next slide, please. So looking specifically, as Maria Teresa said, we looked initially at 5 specific disease areas. And the lens that we're going to take today is to look, first of all, at the impact on disease burden, the role of sex and gender on disease burden, the role of sex and gender in clinical research and practice, and also prognosis outcomes, and then also finally on the impact on life and economic outcomes. So next slide. So first of all, looking at disease burden, across the 5 disease areas that we looked at, 4 of the 5, there was a greater disease burden in women than in men. And this was really important for us to acknowledge, because we recognize that brain disorders and brain diseases are increasing in prevalence. And for a lot of these brain diseases, and this is obviously not all of them, there is a greater prevalence amongst women than there are amongst men. Next slide, please. And then we looked particularly at clinical research and practice. This was really important because first and foremost, from a biological perspective, we wanted to understand what the factors were contributing to a greater prevalence and burden in women. We identified key themes across some of these disease areas around biological factors and sex hormone differential components, but also not only from a biological perspective. So things like pregnancy and hormones play a critical role, but also general factors around diagnostics, availability of treatments, perceptions in clinical practice of women in comparison to men. All factors are captured in the literature. Next slide, please. And then we looked at the economy. And we found really important trends here. Not only are women more likely to leave employment, first and foremost because the burden is more prevalent in women in some of these areas. It takes longer to get diagnosed and therefore progress to treatment, and that means exit from the workforce. But also from a societal perspective, the impact of caregiving and the fact that this is a really important role that women play in society. Next slide. All in all, we found that these factors contributed to a greater burden, both from an economic, individual and family basis for the lack of research that is disaggregated by sex and gender. And overall, we wanted to essentially capture a conceptual framework that brought together all of these factors across the disease areas to define the story for investing in greater sex and gender specific research. We therefore define this conceptual framework that you see presented on the screen here. Ultimately, our ambition is to bring together a lot of the data that is captured in the existing literature and highlights the discrepancy between males, females, men and women in various aspects of the disease journey, and highlight how these impact at an aggregate level on GDP levels. Ultimately, we define this in an overall perspective in 2 streams. So the first is an impact on clinical research, and the second is an impact on clinical trials. Again, the research demonstrated to us that representation between males and females is not based on the burden of the way in which these diseases have a burden on males and females, and actually often is based on data that is very male heavy. And this advocacy piece will support in kind of shifting that balance and focusing more on how the ways in which these diseases present between men and women. And overall, at the bottom of this conceptual framework, you'll see that the greater investment in sex and gender specific research will lead to a change in healthcare expenditure costs, change in availability of funds for other disease areas or health education, a change in educational attainment for caregivers or people that leave the workforce, and overall, and finally, a change in productivity. All aspects that impact the economic prospects of a country and GDP levels. Next slide, please. I think I'm going to hand it back over to Maria Teresa to kind of go through some of the recommendations that came out of this really important research.
Thank you, Amy. Yes, indeed, for us it's very important now that we have some of these findings clear to discuss with this audience a set of recommendations of what we could do to actually change the status quo. We have put together as Women's Brain Project a set of recommendations and a call to action. However, I would suggest actually we start from hearing from our experts, from Anders Wimo and Cheryl Carcel. So I would invite Anders maybe to share with us from his point of view what would be the policy recommendations and how do we get there, and then I will invite Cheryl to do the same, and then at the end I will give you the Women's Brain Project view on this. So Anders, the stage is yours.
Thank you. Hello everyone. I'm so happy that I was invited to make the comments on this very important white paper. Next slide, please. Because it really highlights, of course, the enormous economic impact of brain disorders worldwide. It also highlights very strongly the female underrepresentation in all areas, like in management of care, research, clinical trials, as PIs in trials, and which was a big surprise to me, even in the animal models of disorders, females are underrepresented in terms of being mouse. But of course, and this is of great interest for me, it highlights really the female role as unpaid informal carers. Next, please. But this white paper proposes several calls to action, but we must have in mind that any call to action needs data. And there is a great lack of data of care organizations, how care works in different parts of the world. We have a great lack of data, sex-specific data on resource utilization in care systems, but also great lack of data, sex-specific data of how costs are distributed in different care sectors. And which is the greatest problem, we have very little data from little and middle-income countries. There is a lack of data also for many high-income countries, particularly in LMICs, we have a great lack of data, and that's a major challenge. Next, please. So what can we then do to change this? Well, if you look at the calls for actions, of course, in terms of policymaking and economics, we need to highlight, of course, the need for a care infrastructure for all brain disorders, and we need to highlight the enormous great impact of these brain disorders in terms of cost of illness and so on. And of course, for that work, Women's Brain Project really needs to build networks worldwide with WHO, OECD, patient advocate organizations, the research communities, etc. In terms of research, I wish to focus the need for population-based cohort studies and also how to use big registry data with sex-specific data. We have rather good such data in some high-income countries or many high-income countries, but particularly also in low middle-income countries, we have very little such data, which are highly needed since most people with brain disorders, they live actually in lower middle-income countries in the world. And of course, the problem with under-detection, misdiagnosis, delayed diagnosis, of course, we really must focus more on the accessibility to diagnosis with sex-specific data. And finally then, regarding patient and caregiver involvement, I think it's very good that this white paper really focuses on the consequences for women, both as being patients, but also as being unpaid informal carers worldwide. In high-income countries, perhaps the most common informal carer is a spouse. But in LMICs, low and middle-income countries, the most common carer is a daughter-in-law, or female grandchildren. And for those, there are consequences because they don't get access to education, and also they don't get access to the labor market in a way that they should be able to do. So I think we need to discuss this potential conflict of interest or trade-offs between, on one hand, that informal care might be good for the patients with brain disorders, but it might have several drawbacks for these young women who are withdrawn from education and entering the labor market. So, and in the report, you say that 60% of the unpaid infirmary carers are female. As part of the work that I was doing for WHO, for the report Public Health Response to Dementia, we estimated the female proportion in terms of hours, global hours in infirmary care. And it's about 70% in average. And you can see that there is a gradient between low-income countries to high-income countries, with much more higher proportion of infirmary carers in terms of hours in low-income countries, both in terms of the proportion, but also in terms of hours per day, which also reflects, of course, the lack of a care infrastructure for long-term care of brain disorders in these countries. So finally, I think this report highlights very, very important issues from a female perspective. This is not the end of this work. It's not even the beginning of the end of this work, but as a famous statement said, it might be the end of the beginning of this work. Thank you.
Thank you, Anders. Thanks a lot. A lot of food for thought. And I know you have to run right now, but if there are any questions that are aimed at Anders, we are happy to relay them to him and to organize an answer. So don't forget to ask your questions in the question and answer chat. And again, thanks to Professor Wimo for being here with us. And now I'm passing to Dr. Cheryl Carcel for her expert opinion. Cheryl, tell us, what do you think about this? What can we do to improve the current status? What is the future direction?
Thanks, Maria Teresa. The white paper and the presentations have been very informative, and I thank the Women's Brain Project for this opportunity to speak today. I have to say these presentations are quite a hard act to follow, but I'll try my best and perhaps start with reiterating that sex and gender differences or disparities are real issues in brain and heart health, including stroke, as we have heard. Now, this is a paper that we published the second half of last year, and it's using linked administrative data of ambulance services and hospital admissions of women who have had stroke in New South Wales, the most populous state in Australia. And we had data for over 200,000 people with stroke from 2005 to 2018. And we looked at how women and men were treated by emergency medical services, in particular paramedics. So you can see here that the findings, there are quite a bit of disparity. Women less than 70 were less likely to be assessed as having a stroke and more likely to be assessed as having migraine, anxiety, hypertension, or nausea. And women were also less likely to be managed according to the ambulance protocol. And so why is this important? In stroke, the earlier you get treatment, the more likely you are to save parts of your brain from dying, increasing the likelihood of walking out of a hospital upon discharge versus being wheeled out on a chair or in a chair or sent to a nursing home. And so why do we think this is happening? It's probably from a lack of knowledge about women's symptoms in stroke stemming from inadequate reporting of sex differences in stroke. As medical professionals, we're all taught to recognize patterns, and these patterns make it possible to remember presenting symptoms of hundreds of diseases. Now, it becomes problematic when these patterns that health professionals learn are only representative of one group of people. So I think it's really important to start at the beginning, educating even up to the point of medical students. Next slide, please. Thank you. At the George Institute for Global Health, where I work, we're trying to change this by having more women represented in clinical trials, collecting better sex and gender data, reporting these findings by sex and gender, and increasing female leadership in stroke research, which has been shown to positively influence sex and gender integration in research. And finally, I agree with Professor Wimo and everyone that it's really important to engage with power players. Next slide, please. In 2020, we published a call to action, which is very much aligned with the Women's Brain Project, and we're now working on implementing these call to actions by collaborating with the different groups that you see on the screen with those circles. I'd also like to say that, so this is a project in Australia, but I'd also like to say that the George Institute is conducting a similar project in the UK called the Message Project. And we're all very happy to see that this movement started by NIH many years back has now been adopted in many countries. So thanks again for having me, and very much looking forward to Women's Brain Project's next steps.
Thank you, Cheryl. Now I think it's back to me. I have again the privilege to be presenting to you the Women's Brain Project call to action, which is very much aligned with what you heard from Anders and Cheryl, of course. But I think it's important to put down some of these recommendations, and I'm really much looking forward to a bit of a discussion with this audience, because I know that many of you listening to us today are very actively involved and engaged in this field, especially from the policy side of things. So just in terms of where our commitment comes from and where are we going with this, as I told you, the overarching goal of Women's Brain Project is to transform the current state of medical treatment and drug development through a sex and gender lens as a gateway to precision medicine. We have been pushing and pioneering medical research and clinical research, preclinical research in this. The way the Women's Brain Project works is an extremely collaborative one, working, as you see here in this visual. We see ourselves kind of at the center of a wide network that involves all the different stakeholders: the scientists, the healthcare professionals, government and policymakers, payers, regulators, pharma industry, and very important for us, patients and caregivers. So it is with this spirit. Now wait, if we can stay on the previous one. It is really with this spirit that we intend to build a research institute for sex and gender precision medicine, where we drive research, but we also catalyze energies and initiatives from different stakeholders. So this work, this transformation, as Cheryl has said, and also Anders, it's actually a big one, a systematic one. And of course, Women's Brain Project cannot do it alone. Nobody can do it alone. We can only do it if we combine our forces with collaborative efforts. And so this is really to reinforce our commitment to work with all of you and all the stakeholders to promote this much needed change. And that's also the way we build our call to action, that you will see is very much 360 degrees, because we feel that based on what we know, what is published so far in our white paper, there is a need for things to change at least at 4 levels. So you will hear our some actionable points from us at 4 levels. One is policy, then of course research, healthcare professionals, and patients and caregivers. And they are all equally important for us, and they all have to happen for a meaningful change in our society. So if we go to the next slide, is the slide dedicated to policy. Our main call to action in policy is, of course, to make brain and mental health a priority through policymaking and economic prioritization. So we are joining our voice to many others also in this call today. I've seen many names. All the institutions that are calling for more funding, especially the EU level, for research and for better understanding of brain diseases. But we are calling specifically for more funding on sex and gender differences. We think it's extremely important to agree on best practices and common protocols, especially that govern clinical trial research, as well as their funding, to take into consideration sex and gender differences. And we think an absolute priority is, of course, reducing the burden borne by caregivers. As Anders has highlighted, this is a huge burden on the society, which falls mostly on women. And we have to find ways to support caregivers, which is via training, financial support, pension, health prevention. Like, it really has to be a priority. In terms of research, and this is very dear to me as a researcher myself, our main call to action is that we need data. And this is really echoing what Anders just said. Even though there has been quite a lot of research lately, we have a lot of publications, but still our systems are not built, our current practices are not built in a way that systematically collect and report sex stratified data. So for an informed decision making, we need proper quality data, and this is what we're missing. So we are asking for more equitable and representative preclinical and clinical research with sex stratified results, more inclusive trial designs that include men, women, and of course we will have to consider all the other minorities as well as we move forward. To reach the high quality data that we're talking about, possibly also data, something that is very dear to me, data that actually capture as well women's health variables. So clinical trials that capture women's health variables like contraception, parity, HRT use, all this very often is missed, is not recorded in our studies, and it's a missed opportunity, misunderstanding. These are complex studies to run and registries and data to collect. So this will require multi-sectorial partnerships, and similarly for sex stratification of data for biomarkers. And finally, a call to action to health economists. Again, as Anders said, we need more data also on the economic impact of brain diseases, the healthcare resource utilization. And again, the dimension of sex and gender imbalances and differences or specific characteristics has not been properly considered until now. So we also have a call to action to the health economists listening to us that we need also more data in this sense. Third is healthcare professionals, very important for us to work with them. We think the main call to action here is more education, because educated healthcare professionals then enable better diagnosis, access to treatment and management of patients. So we are strong advocates for education from the basic curriculum, but then also continuing medical education. We need to work with healthcare professionals to build, develop, and support better care pathways that are responsive to specific needs of patients, men, women, different ages, different. We have to listen to the patients, including the patients. And we are also advocating for the use of multidisciplinary team approach. And the final point, super important for us, patients and caregivers. We cannot improve the current status of healthcare without including the voice of patients and caregivers. We need a meaningful involvement of them, who are the real experts. And this involvement actually should go, in our call to action, we really think that the involvement should start already in the design of research, even preclinical research. It's really unbelievable the insights that expert patients can bring to the table. So this has to be used, both men and women, because they bring different perspectives. Of course, we need to ensure support for caregivers, as we said. And in this bucket specifically, we want to highlight the importance and the potential of using digital solutions, especially telemedicine, digital biomarkers, anything that brings the doctor to the homes and empowers the patients, allowing them to run a number of tests or to track their symptoms. I think this is a future much needed direction that can support healthcare in general, and in particular, patients and healthcare professionals. So I think this is the last slide, right? Yes, and at this point I will pass to Anna to take us to the various steps of the launch and the next steps of this project.
Thank you so much, Maria-Teresa, and thank you also for those who are submitting questions. We'll try to get to those as soon as we can. We just wanted to very briefly now take you through the launch process and next steps. So we actually launched the other day on 8th of March, which was the official launch on the occasion of International Women's Day. So already live, we have the white paper, we have the call to action, press release, and other key deliverables as well. So you're very welcome to access those on our Women's Brain Project website. And if Ali and Eva can share the website link for those materials through the chat, that would be great. So we have a dedicated landing page there. Then in terms of next steps, there'll be further comms rollout in the coming days and weeks. So do watch this space. And we'll also be, as Maria-Teresa outlined, we'll be using our call to action as a dedicated policy campaigning tool, whether that's direct outreach on a one-to-one basis with policymakers or more broad through various channels. We'll be doing that as well in the coming weeks. I should also add as well, feel free with these materials if you're active at a national level, a regional level, or a global level from a policy point of view. If you feel that at all that the call to action resonates with your work, please feel free also to use that in your stakeholder outreach. From a project point of view, so what we've presented thus far is what we call the phase 1. Phase 2 will actually bring the modelling protocol to life with inputs and assumptions derived from the conceptual framework that Emmy presented earlier. So the initial pilot here will focus on one geography and in one disease area is the plan. We have a lot of interest already from potential sponsors for this phase 2 part of the project. And this is where it gets really exciting because we'll be generating new and raw data on the economic impact of investing in disease-specific sex and gender research. So if you do want to get involved with us on this, we do ask that you contact us as soon as you can by email, and we have there our info@womensbrainproject.com email address, and then we'll be happy to set up a meeting with you to explore how we can move forward on phase 2, because as I said, this will move forward quite quickly. So in fact, here we've presented a timeline where we will kick off the phase 2 part of the project in April. And there you can see actually the methodology. Some of these timelines may change, but the methodology there in principle, you have all the steps. So whether that's then going into data collection, modeling the pilot, and then generating the new raw data, which is a really exciting part of this. And then also creation then of the final readout and reports. And we're aiming to have a launch potentially and hopefully by our International Women's Brain Forum, which should be taking place in November this year. So indeed, so just coming to the forum. So this is our flagship event. We're very much looking forward to this. It will be taking place on the 24th to the 25th of November in Zurich in Switzerland. And this really will bring together all international leaders in the global brain health community to discuss the potential solutions and addressing some of those roadblocks we've presented earlier. And we'll certainly be having a deep dive conversation as regards policy solutions, and then also looking at the planners, the results of the phase 2 of this project. So we do hope you can join us for this forum in Switzerland, but also you can also join us, of course, virtually. It will be a hybrid event online and in person, but we hope as many of you as possible can join us in person for this really landmark forum. And then also, obviously November is still quite far away. So during the coming months, we'll be attending a number of events, conferences, scientific conferences, regulatory events. We have our own regulatory roundtable series. We'll be having also social media campaigns around key disease awareness days. So these will be other opportunities where we'll be doing different cuts of the work, perhaps having more of a disease focus, as Cheryl presented earlier on stroke. We'll be doing that with the different neurological conditions that were covered as part of this work. So please feel free to like, share key findings that we put out on social media and so on. And then I pass over back to Maria-Teresa, who will finalize with our overarching goal, and then we hope, time permitting, to get to some of your questions.
Sure. So very briefly, because I would really like to answer some of the questions. As mentioned before, we are in a transformation phase, as some of you maybe already know. This is, as I told you, an association with the goal of transforming the state of medical treatment through sex and gender lens as a gateway to precision medicine. And so far we have done it as an association, which is not the ideal legal form for this type of work. We have done a lot of work, as you probably know, from basic preclinical, clinical research side of things, lots of papers. We have worked a lot on the clinical implementation and the regulatory framework. This project belongs to a number of activities we have done in the socioeconomic dimension, policy and advocacy of brain and mental disorders. And we have a fourth pillar of activities that focuses on novel technologies and AI for healthcare. So this is all that we are doing, and we will continue doing it. But this year, we'll see the transformation of our association into a foundation, which is, in our opinion, the ideal legal entity to continue these activities, to bring them to a next step. And also to operate the Research Institute for Sex and Gender Precision Medicine that we want to create. So stay tuned, because this is happening this year, and we hope we will be able to collaborate with many of you with the Research Institute. And now we can have a look at the question and answers. I saw there were many people connected. I saw there were quite a lot of messages in the chat and a few questions in the Q&A as well.
Yes, so what I'll do, I'll select some of the questions. I don't know if we'll be able to get to all of those, and apologies in advance for that, but certainly what we'll be doing is getting back to your questions in due course in writing if we don't manage to address them in the next minutes. We have a scientific question I'm going to pose first of all, Maria-Teresa.
Mm-hmm.
So within scientific research, Shabana asks, most of our current understanding about molecular mechanisms of pathophysiology of neurological diseases comes from cell lines, preclinical models, which have not considered sex-gender differences. Does this mean most of our understanding is skewed, biased, and we need to revisit many studies considering sex and gender?
Thank you so much. This is such a beautiful question, and it's currently a main focus of the activities of the Women's Brain Project, because I have the impression that researchers are starting to receive the message that clinical research, preclinical research, we need to use men and women, female and male mice. But the preclinical research, and especially the cell lines and everything that happens in vitro with organoids, organ on a chip, and all these other models, which are super relevant for drug discovery especially, it is true, it has been done without considering these differences. So as Women's Brain Project, we are working on a review paper to actually highlight this specific issue and propose a set of recommendations. But I agree with the person with Shabana who posed the question. We might need to go back and check again, and the data might be there, or we might need to run new experiments. And again, I would like to highlight that this should not be seen as, you know, more work to do and more resources to invest, but actually this might result in insights that might actually help us and might be leverage for better drug design, better treatment, safer drugs, and all that. So I think there is a lot of work to do, yes, and it's worth it.
Mm-hmm. Then I'm just jumping to another question here. Denise is asking about differences between women and men when it comes to prevention in this area.
These are humongous differences, and we have incorporated them in the model. I don't know if Emmy is still online. Maybe she can comment on that, because it was a specific portion of the model, at least for some diseases. So that could be a question for Emmy. I'm not sure if she's there. But just to mention, you know, for both stroke and Alzheimer's disease, for migraine, for all the diseases we have been looking at, there are very clear evidence of sex differences in risk factors. In the case of stroke, it's very clear that a lot of the campaigns, awareness campaigns, have been directed towards men and have neglected women. Emmy, I don't know if you want to comment on this question, if this is something you want to add.
Yeah, I think you just answered it. Basically, we definitely looked at risk factors. identification of risk factors. But I think as the general advocacy point is the fact that women, sex and gender differences are not highly prioritized in research and disaggregated means that there are some risk factors that might not necessarily be recognized or identified. And again, is another area that should be focused on in such research approaches and greater focus when we look at sex and gender differences. But definitely has been incorporated in the conceptual model and also the literature review.
Mm-hmm. Thank you so much. And then Rochelle asks us what has to happen for the pharmaceutical industry to drive this agenda forward. Who wants to answer that? Maria-Teresa?
Yeah, I'm thinking we might have somebody in the audience that might be also interested in answering this question. I think making the economic case of the importance of this agenda is a step forward. I think this might be an important step. I would be very interested in hearing from representative of the pharma sector what type of evidence we are missing on what other insight might be needed to actually drive this agenda, as Rochelle says. So this is an important discussion to have. And I hope this white paper has helped a little bit, has given some elements.
Thank you. And then Julia asked us the $1 million question that we always get. So how do we sort of differentiate between the focus on biological, sex-driven differences and then more gender, social-based differences? How do we differentiate there and navigate that terrain as Women's Brain Project?
Yeah, this is the $1 million question, and it's not easy at all. We have used the sex and gender definition of the WHO, so biological versus socioeconomic. Even that is not an easy distinction to make. And to be honest with you, we even lack the data. So the way we collect the data, we don't even know whether the men, and when we see men and women in studies, we don't know whether that's self-reported, is what they identify with, is what the doctor thought they were. So it's really a complicated issue, and we need definitely more research also to come up with a way to measure both. Sex is relatively straightforward, but also gender, so that we can actually, dissect these two components, because they are always intertwined and it's very hard to separate them. And I think moving forward, that's a priority for us researchers. But at the moment, it's not so easy to identify this.
Mm-hmm. And then Ariana is interested to know a bit more about our forum that we actually, and that's correct. So the full title of our forum is the Women's Brain and Mental Health Forum, and Ariana would like to know a bit more what we propose to cover under the mental health banner.
This is still open for discussion. Actually, we are brainstorming topics. Something that I would really like to bring is mental health, perinatal mental health, so mental health around pregnancy and especially around miscarriages and abortions, which is a taboo. Nobody wants to talk about it. We are running a specific study about it. And this could be something that we bring to the forum. In the past, we had panels on suicides, on maternal mental health and the treatment of mental health conditions during pregnancy. So mental health has always been a big focus of our forum. So if there is any suggestion from the audience, actually very happy to listen to them.
And then we have a specific question from Rochelle about Parkinson's treatment. I suggest, Rochelle, that we'll get back to you on this offline because it's very specific, but we have taken note of your question and we'll get back to you if we may after the webinar on that. Do we have any more questions about next steps or any other thoughts? There is a question here about phase 2. So Jaya Lakshmi is asking, how can we get more information on phase 2 of this project, as shown just a couple of slides, but how can we get further information on that? So I think we already answered that. We've just presented indeed 2 slides there, but if you would like further information, don't hesitate to contact us at our info email, info@womensbrainproject.com, and then we can share with you further information, or even, you know, if you want to collaborate with us on that, we can set up a specific meeting. So I hope that answers your question. And then I'm just thinking, are there any further questions here we can answer? Rochelle is asking, is there a way to collaborate together across the different neurological organizations to drive this forward? I think we have seen that from an advocacy point of view, Rochelle, with, you know, recent initiatives with them, certainly at a global level with One Neurology, and then certainly at a European level with various organizations, whether that's EFNA, EAN, and then European Brain Council, amongst others, including obviously eBrain's Human Brain Project. And we all work together very collaboratively on that. Obviously, some of our focus points tend to be quite different. And then certainly from a Women's Brain Project perspective, we very much focus on sex and gender perspective. And then I would ask Maria-Theresa, do you have any additional thoughts on that from an advocacy point of view?
No, absolutely. What you said, I'm delighted to see that this topic is adopted more and more by different organizations, because I think the more people, you know, the more voices we have, the better it is. Also, EFMA recently, the WHO has adopted a lot of our, you know, notes about gender differences. So, as we said, this can only be done as a collaborative effort. So, the more the merrier.
Mm-hmm. And I think we have some additional questions, but I think we're conscious of time. So what we'll do, we will get to all of your questions, and then some very good additional questions were coming through there. Some were quite specific. So we will get back to you in detail in writing. But I think we just wanted to spend the last minute to say a big thank you for your interest in Women's Brain Project, your interest in this work that we've done with the Economist Impact, and we really value your time and your interest. And then Maria-Theresa, would you like to give the final closing?
Yes, a big thank you, and an invitation to follow us, to contact us, to support us, to work with us. And yeah, I hope that this will be the beginning of a lot of new projects. And send us your feedback. We're always interested in that. So thank you.
Thank you, everyone. Bye.
Bye.